So my mum travelled to Dubai on holiday just before the pandemic. And then obviously when the pandemic hit, the country went into lockdown and she was stuck here. So she had all of her medications from London, however her condition got worse and worse. So she would take tablets probably every 3 hours. And there was a concoction of tablets. Yeah. She got really confused. She wouldn't recognise me. She didn't know my name. She didn't know her grandchildren's name. She got quite aggressive. She stopped eating. My career basically got put on hold. I've got 2 young kids. I was helping my mum in the morning before I went to work, get changed, give her a medication. Often it would be disturbed nights. You know, she would be waking up, screaming, shouting, not knowing where she was. So actually at that stage I did think that I needed to possibly quit my job. My only option was to send my mum home. But whilst we were thinking about that, I decided to do some research. I was Googling Parkinson's treatments in Dubai. And then I came across Dr. Mehta and the team at King's College Hospital, London, Dubai. And it was our last chance. We just thought we'd give it a go. My sister, Sheena, also being a doctor, found out that from King's College, London, that the same team would visit Dubai. She was wheelchair bound at the time, confused, fluctuating blood pressure. She was also having falls.
I was miserable. I was annoyed.
Yeah.
Lots of things happened.
Yeah.
And I never had a good time. I lost 13, 14 years in sorting this out. But this is a very, very good news to me that, I'm doing well. I feel really good. My life has come back. I'm enjoying myself with my grandchildren. I enjoy shopping. I enjoy shopping and I enjoy Dubai. Yeah.
As a medical professional myself, so I'm a GP working here in the UK for the NHS, I could see my mum's Parkinson's disease was advancing. So it's becoming quite clear to me that the oral treatment for her Parkinson's disease was no longer effective, and we plan to look into further treatment such as Duodopa here in the UK. When she has got her quality of life back, she is able to mobilise independently, she doesn't need any walking aids, and she's no longer had any falls. She's much happier in herself, she's got her smile back. We did a lot of research and we know they're a centre of excellence, which is why we chose them. And I have to say that the treatment that my mum got was first class. We just wanted to say a huge thank you to all the team at King's College Dubai, including the nursing staff, the ward staff, but in particular to the Duodopa team, namely Professor Chowdhury, Dr. Guy, Rochelle, who's a Duodopa specialist nurse who's just been fantastic, and last but not least, of course, Dr. Mehta, who has overseen my mum's care and from day one has looked after her and provided support to us as a family brilliantly.
I'm very pleased to see how well Mrs. Diksha Raja is doing following the Duodopa infusion implementation. I would like to tell you a little bit about what the Duodopa infusion is involved and how it's implemented. Firstly, the Duodopa tube is fed directly into the small bowel, and this is done via a small incision through the abdominal wall which goes directly into the stomach. We then pass a very small tube called an endoscope down into your mouth, into the stomach, and this is used to guide the tube directly into the small bowel. It is there that a very precise dose of the Duodopa infusion is implemented in order to deliver the maximum benefit while minimize any side effects.
Hello, my name is Ray Chowdhury. I'm a professor of movement disorders and neurology here at the King's Parkinson Centre of Excellence in London. This short video clip is about Mrs. Diksha Raja, who is a mutual patient who had a diagnosis of Parkinson's disease, which was diagnosed here in the UK. Her condition, as is usual for Parkinson, had progressed and she was in need of advanced therapies. Given the severity of her condition, in conjunction with Dr. Mehta and Dr. Chung Fei, I was able to initiate her on levodopa infusion therapy at King's College Hospital in Dubai. The progress since the initiation of levodopa infusion therapy has been remarkable. A person who was wheelchair bound, unable to mobilize, and had to depend on 4 carers for her day-to-day activity is now completely independent, is able to mobilize herself, is able to go out shopping, is able to feed properly, and is able to also socialize to some extent.
To summarize the challenges we faced with Mrs. Diksha Raja is not just her Parkinson's. The main priorities, the top priorities for any clinician in her case is, number 1, to optimize her blood pressure, to optimize her medication regime, and to make sure she's not getting any recurrent infections. For implementing these advanced non-oral infusional therapies requires a commitment and a dedicated clinical team, a neurologist and a Parkinson specialist who knows how to convert the oral dosing to a gel form because of her weight. So slightly increase in intrajejunal infusion regime, she become more dyskinetic. And we have seen after 48 hours, we have seen that her BP was stabilized, her motor fluctuations are stabilized, and she was able to walk unaided. I have to say it's very important for the Parkinson's patients and the communities to connect together, to share their knowledge and to share their problems. I'm extremely grateful to Her Excellency Sheikha Fatima Al Maktoum. She kindly visited our Advanced Parkinson Center of Excellence at King's College Hospital, London, Dubai, just to meet and greet the patient Diksha after she heard from Parkinson Society UAE, the way she came to Dubai on a holiday to stay with her daughter, and in the last 6 months her condition was deteriorated where she became a wheelchair bound. Now she got new lease of life at King's College Hospital, London, Dubai. So I'm eternally grateful for her humbleness and self-effacing appreciation of her pioneering work at King's College Hospital, London, Dubai. And it will be one of my lifetime memoirs.